You know that feeling, right? One minute you're fine, the next, bam, it feels like you've been hit by a bus. The aches, the chills, that cough starting up, we usually just call it the flu. But really, how much do we actually know about what's going on inside our bodies? Today, we're doing a deep dive into influenza. Now, this is the contagious respiratory illness. It's not the common cold, and it's definitely not that stomach flu people talk about. That's a whole different thing. We're talking about the viruses that go for your nose, your throat, and deep into your lungs.
Right. And our mission today is really to get past just the sniffles and the fever. We want to unpack the fascinating biology behind influenza, look at its history, which is pretty profound, actually, and give you the practical stuff you need to know. We'll explore what makes this virus so, unique, why it's still such a big global challenge every year, and what all this means for your health.
Let's dig in. First off, let's be crystal clear on definitions. Influenza. It's a respiratory illness. It is absolutely crucial to separate this from gastroenteritis, what people sometimes call stomach flu. That's usually viable too, but it affects your digestive system, causing diarrhea, vomiting, totally different ballgame.
Exactly. When we say flu, it's the airways. And importantly, it's caused by viruses, not bacteria, so antibiotics won't touch it. And, one thing that often catches people off guard is just how fast it hits.
Right.
Unlike a cold that might sort of creep up on you maybe over a day or two, flu symptoms often just, bam, they appear really abruptly, sometimes within 2, maybe 3 days after you've been exposed. And the intensity is usually much higher. You generally feel a lot worse than you would with a cold. That sudden, severe onset is a classic sign.
Okay, so it hits hard and fast. But are all these flu viruses the same beast?
That's a great question. No, they're not. Our sources point to 4 main types, A, B, C, and D. And they have pretty different personalities, so to speak.
Yeah, they really do. Type A and Type B, those are the ones causing the big seasonal epidemics we brace for every year. Type A is kind of the heavy hitter. It causes most of the severe illness, and it's responsible for all the known pandemics we've had. And get this, Type A viruses. Their main home, their natural reservoir, is in wild aquatic birds. That's where they originate.
Fascinating, isn't it? Whereas Type B mostly just circulates among humans, can still make you pretty sick, cause outbreaks, but it doesn't have that same pandemic potential as Type A.
Okay, so A and B are the big concerns for seasonal flu. What about C and D?
Type C usually causes really mild symptoms, often just like a common cold. Sometimes people don't even realize it can be asymptomatic. It tends to affect kids more often.
So not a major public health threat, generally.
Generally not. And Type D, well, that's been found mainly in cattle and pigs. It can technically infect humans, but as far as we know right now, it doesn't actually cause illness in people. So less of a worry for us day to day.
Okay, so focusing on A and B then. If you're feeling awful, how do you differentiate? What are those classic flu symptoms we should be looking out for?
The big ones are usually a sudden onset of fever, or feeling feverish with chills, a cough often dry at first, sore throat, runny or stuffy nose, muscle or body aches, headache, and serious fatigue, like profound tiredness.
That fatigue really knocks you out, doesn't it?
It really does, and sometimes people experience sweating too. But it's worth noting, symptoms can vary a bit, especially with age.
Oh, so?
Well, children, for example, might show more general irritability. They might complain of ear pain or have more nausea, vomiting, or diarrhea compared to adults. That's more common in kids with flu.
Okay.
And occasionally, some people might also get eye pain, watery eyes, or find they're really sensitive to light. That can happen too.
Right, and if you get that cluster of symptoms, especially the sudden start, and it happens during the typical flu season, which is roughly October through May in the Northern Hemisphere, it's pretty likely you're dealing with influenza. The timing itself is a big clue.
Absolutely. So connecting that to how it gets around, how does something this common spread so effectively? It's all about respiratory droplets.
Droplets, okay.
Yeah, when someone who's infected coughs or sneezes or even just talks, they release these tiny droplets containing the virus into the air. You can breathe those in directly if you're close by, or the virus can land on surfaces, doorknobs, phones, keyboards.
Yeah.
And then you touch that surface and then touch your own eyes, nose, or mouth, and boom, you've potentially infected yourself.
And it's not just the big droplets you can almost see, right? There's more to it.
Exactly. That's where it gets maybe a bit more insidious. Those larger droplets fall pretty quickly. But there are also smaller particles, aerosols, that contain the virus. These can stay suspended in the air for longer periods, and they can travel further than just a few feet.
Wow. And the timing of when you're contagious is also tricky.
Very tricky. You can actually start spreading the virus about a day before you even feel sick.
A whole day before.
A whole day before symptoms start.
Right.
And then you typically remain contagious for about 5 to 7 days after you get sick.
Okay.
But, and this is important, children or people with weakened immune systems might be able to spread the virus for even longer than that, which makes controlling outbreaks pretty challenging.
It really does. Now, you mentioned earlier the virus isn't always the same, it changes. This seems key to why flu is such a persistent problem.
It is absolutely central to the challenge of influenza. This virus has this uncanny ability to constantly change, to evolve. Our sources talk about two main ways it does this: antigenic drift and antigenic shift.
Drift and shift. Okay, what's the difference?
So antigenic drift involves small, gradual changes. Think of it like tiny spelling errors accumulating over time in the virus's genetic code. These small mutations happen pretty constantly, especially in the genes for the surface proteins like hemagglutinin or HA, which the virus uses to latch onto our cells.
And those small changes are enough to fool our immune system.
Enough so that immunity you got from a previous infection or last year's vaccine might not fully recognize the slightly drifted virus. That's why the flu vaccine has to be updated almost every single year. We're constantly playing catch-up with these drifts.
Okay, so that's drift, small, slow changes. What about shift? That sounds more dramatic.
It is much more dramatic. Antigenic shift is a sudden major change in the influenza virus. It happens when, say, two different flu strains, maybe one from a bird and one from a human, infect the same cell, perhaps in an animal like a pig.
Ah, the mixing vessel idea.
Exactly. Inside that cell, the genetic segments from the two different viruses can get mixed up and reassorted, creating a completely novel hybrid virus. This new virus might have surface proteins that are totally unfamiliar to the human immune system.
And that's how pandemics start?
That is the mechanism behind pandemics. When a radically new type A virus emerges through antigenic shift, one that can infect humans easily and spread efficiently person to person, and to which most people have little or no immunity. Well, that's the recipe for a global pandemic.
Wow. So pigs, you mentioned, but also bats, quails. These animals are key because they can be infected by both bird flus and mammal flus.
Correct. They have the right kind of receptors in their respiratory tracts to allow viruses from different species to get in and potentially mix, leading to these dangerous reassortment events. That's why monitoring animal influenza is so critical for predicting and preventing human pandemics.
Okay, so the virus gets in maybe through those droplets or aerosols. What actually happens inside our body that makes us feel so sick?
Well, once it's inside, the influenza virus primarily goes after the epithelial cells, the cells lining your respiratory tract, from your nose down into your lungs. It hijacks these cells to make more copies of itself, and this process damages or kills the cells. The illness, you feel the fever, the aches, the cough, is largely due to the resulting inflammation in your lungs and airways. It's partly the direct damage from the virus, but it's also compounded by your own immune system launching a powerful counterattack.
Sometimes too powerful, right? I've heard of cytokine storms.
Exactly. In some severe cases, the immune response can become dysregulated, exaggerated. It releases a flood of inflammatory molecules called cytokines. This cytokine storm can cause widespread inflammation and damaged tissues, not just in the lungs, but potentially in other organs too. It's thought to be a major factor in severe or fatal flu cases, especially during pandemics like 1918.
But our bodies do try to fight back effectively most of the time.
Oh, absolutely. Your immune system produces interferons. These are proteins that interfere with viral replication, and it starts generating specific antibodies to target and neutralize the virus.
But the virus has tricks up its sleeve, too.
It does. Influenza viruses have these clever non-structural proteins like NS1, whose job is basically to try and suppress or evade parts of your immune response, especially those early interferon signals. So it's this constant battle going on at the cellular level.
It's really quite an arms race. So understanding all this complexity, who really needs to be most careful? We know most healthy people recover, but who is at higher risk for serious problems from the flu?
That's a really critical point. Identifying those high-risk groups is essential for prevention and treatment strategies. The main categories include age is a big one. Young children, particularly infants and toddlers under age 2, and older adults, typically those 65 and older, their immune systems may be less robust.
Okay, the very young and the elderly.
Then, people with certain underlying chronic health conditions. This is a broad groupthink. Chronic lung diseases like asthma or COPD, heart disease, diabetes, neurological conditions, kidney or liver disease, blood disorders like sickle cell disease.
So a lot of common chronic illnesses put you at higher risk.
They do. Also, anyone with a weakened immune system. This could be due to diseases like HIV/AIDS, certain cancers, or because of medical treatments like chemotherapy, long-term steroid use, or drugs taken after organ transplant.
Makes sense.
Pregnancy is another important factor. Pregnant people, especially in the second and third trimesters and even up to 2 weeks postpartum, are at increased risk of severe flu complications. Other factors include people living in chronic care facilities like nursing homes, individuals with extreme obesity, usually defined as a BMI of 40 or more. And unfortunately, data from the U.S. shows that certain racial and ethnic minority groups, including Native Americans, Alaska Natives, Black individuals, and Latinos, experience higher rates of flu-related hospitalization. The reasons for this are complex, likely involving socioeconomic factors and access to care as well.
And there was one specific group you mentioned earlier related to aspirin.
Yes, a very important warning. Children and teenagers who are receiving long-term aspirin therapy. They are at risk for Reyes syndrome if they get influenza.
So for these high-risk individuals, the flu isn't just a week of feeling miserable. It can lead to really serious outcomes.
Precisely. It's not just a bad cold for them. The potential complications can be quite severe.
What kind of complications are we talking about?
Well, beyond the initial viral illness, you can get secondary bacterial infections. Things like sinus infections, ear infections are common. More seriously, pneumonia is a major risk. This can be primary viral pneumonia caused directly by the flu virus invading the lungs deeply, or it could be secondary bacterial pneumonia, where bacteria take advantage of the flu-weakened lungs.
Pneumonia is definitely serious.
Very. Other potential complications, though less common, can include inflammation of the heart muscle, called myocarditis, inflammation of the brain, encephalitis, or the tissues surrounding the brain and spinal cord, meningitis, or multi-organ failure. And in severe cases, influenza can lead to acute respiratory distress syndrome, or ARDS, where the lungs fill with fluid and can't get enough oxygen into the bloodstream. This often requires intensive care and mechanical ventilation.
And that warning about Reyes syndrome in kids taking aspirin during flu.
It bears repeating. Reyes syndrome is rare, but it's incredibly serious. It causes sudden swelling in the liver and the brain. While the exact cause isn't fully understood, it's strongly linked to aspirin use during viral illnesses like flu or chickenpox in children and teens.
So the message is clear. Avoid aspirin for kids with flu-like symptoms. Use acetaminophen or ibuprofen instead, if needed for fever or aches.
Absolutely. It's a critical piece of advice.
Okay, this is sobering stuff, so let's pivot to defense. What can we actually do to protect ourselves and the people around us? Prevention must be key.
Prevention is, without a doubt, the cornerstone of dealing with influenza. And the single most effective preventive measure we have is the annual flu vaccine.
The flu shot.
The flu shot, or the nasal spray vaccine in some cases. The CDC recommends it for everyone 6 months of age and older every single year, unless there's a specific medical reason not to get it.
And it really works. I know some people are skeptical.
It does work, though its effectiveness can vary year to year depending on how well the vaccine matches the circulating viruses and individual factors. But even in years where the match isn't perfect, vaccination still significantly lowers your risk of getting the flu in the first place. And maybe even more importantly, it dramatically reduces your risk of having serious illness, needing hospitalization, or even dying from the flu if you do get sick.
That's a crucial point. It's not just about preventing infection, but preventing severe outcomes.
Exactly. And a bonus point for pregnant people. Getting vaccinated during pregnancy not only protects them, remember, they're high risk, but the antibodies they develop can cross the placenta and provide protection to their newborn baby for the first few months of life, when the baby is too young to be vaccinated itself.
That's fantastic passive immunity. Okay, so vaccination is number one. What else? The everyday stuff matters too, right?
Absolutely. Basic infection control habits are vital, especially during flu season. This includes frequent hand washing, thoroughly, with soap and water for at least 20 seconds. Or use an alcohol-based hand sanitizer if you can't get to a sink.
20 seconds sing happy birthday twice, right?
Yeah, it's the classic advice. Also, try hard to avoid touching your face. Your eyes, nose, and mouth are the main entry points for the virus.
Harder than it sounds sometimes.
It really is.
Yeah.
Covering your coughs and sneezes is also key. Use a tissue, throw it away immediately, then wash your hands. Or cough or sneeze into your upper sleeve or elbow, not your hands.
Right.
Cleaning and disinfecting surfaces that are touched frequently. Doorknobs, light switches, phones, keyboards can help too.
And staying away from others if you're sick.
Crucial. Avoid close contact with sick people if you can. And if you get sick, stay home from work, school, and errands. Wait until you've been fever-free for at least 24 hours without using fever-reducing medicine. That helps prevent spreading into others. Avoiding crowds during peak flu season can also reduce your exposure.
These seem like simple things, but they add up.
They really do. And our sources also mention efforts beyond individual actions, things like biosecurity on farms to control flu in poultry and pigs, and even specific animal vaccines. These help prevent animal strains from potentially jumping to humans, tackling that antigenic shift risk we talked about.
Right, addressing the source. Okay, so let's say despite precautions, someone gets sick. You mentioned symptoms can overlap with other things. How do doctors actually confirm it's the flu?
That's a good point. During peak flu season, if someone comes in with those classic abrupt symptoms, doctors often make a clinical diagnosis based on that presentation.
An educated guess based on symptoms and timing.
Pretty much. But for a definitive diagnosis, especially if someone is severely ill, hospitalized, or if it's important for public health tracking, like detecting a novel strain, laboratory tests are needed.
What kind of tests?
The most common involve collecting a sample from the back of the nose or throat using a swab. Then, that sample can be tested in a few ways. Rapid influenza diagnostic tests, or RIDTs, can give results quickly, maybe in 15-30 minutes, right there in the clinic. They detect the viral antigens. They're convenient, but they're not the most sensitive. They can sometimes miss infections, giving a false negative.
So quick, but maybe not perfectly accurate.
Correct. There are also rapid molecular assays, which are faster than traditional lab tests and more accurate than RIDTs. But the gold standard really is reverse transcription polymerase chain reaction, or RT-PCR. This test detects the virus's genetic material. It's highly sensitive and specific, very accurate, and can even tell you the type, A or B, and sometimes the subtype of the virus. It usually takes a few hours to get results back from a lab.
Okay, RT-PCR for the most accuracy. So once it's confirmed or strongly suspected, what's the treatment plan?
For most people with uncomplicated flu, those who aren't in a high-risk group and aren't severely ill, the treatment is mainly supportive care focused on relieving symptoms, meaning rest. Plenty of rest. Drinking lots of fluids, water, broth, juice to prevent dehydration, and using over-the-counter medications for fever and aches like acetaminophen or ibuprofen.
But again, not aspirin for kids or teens.
Cannot stress that enough. No aspirin for under 18s with flu-like illness.
Okay, but what about those antiviral drugs we hear about?
Right, antivirals are an important tool, especially for people who are very sick or are at high risk of complications. These are prescription medications that fight the flu virus directly.
How do they work?
The main class currently recommended are the neuraminidase inhibitors. These include drugs like oseltamivir, you probably know it as Tamiflu, which is a pill, and zanamivir, Relenza, which is inhaled. There's also an IV version, peramivir, for hospitalized patients. These drugs work by blocking the neuraminidase enzyme on the surface of the virus. The virus needs this enzyme to escape from an infected cell and go infect other cells. So these drugs basically trap the virus inside the cells it is already infected, limiting the spread.
Clever. Does timing matter for these?
Timing is absolutely critical. Antivirals work best when started very early, ideally within 48 hours, 2 days of when symptoms first began.
Within 48 hours. Okay.
Starting them early can shorten the duration of illness by about a day, and more importantly, it can reduce the risk of serious complications like pneumonia, hospitalization, and death, particularly in those high-risk groups.
So if you're high risk and you think you have the flu, call your doctor quickly.
Definitely. Don't wait it out. There's also a newer antiviral called baloxavir marboxil, the Influenza, which works differently. It inhibits an earlier step in viral replication, but the principle is the same. Start early for best results.
Are the older antivirals still used? Like amantadine?
No. Drugs like amantadine and romantadine are generally not recommended anymore because widespread resistance has developed in circulating flu strains, making them ineffective against most current viruses.
Good to know. Okay, let's zoom out again. We've talked about individual illness, but influenza is a massive global issue. What does the big picture look like?
The scale is truly immense. As our sources highlight, estimates suggest that somewhere between 5% and 15% of the entire world's population gets infected with influenza each year.
Wow, 5 to 15%. That's hundreds of millions, potentially billions of people.
Exactly. And that leads to roughly 3 to 5 million cases of severe illness annually worldwide. And tragically, influenza is associated with somewhere between 290,000 and 650,000 respiratory deaths globally every single year.
Those numbers are staggering. It really puts the impact into perspective.
It does. And we see distinct patterns. In temperate climates like North America and Europe, flu activity usually peaks during the winter months.
Right, our flu season.
But in the southern hemisphere, their winters are summer, so their flu season is opposite ours. And in tropical regions, influenza can actually circulate year-round, sometimes with semi-annual peaks. Things like temperature and humidity seem to play a role in this seasonality, but it's complex.
And this isn't a new problem. You mentioned it goes way back.
Way back.
Yeah.
Descriptions that sound very much like influenza appear in writings from ancient Greece as far back as the 5th century BC with Hippocrates. And we have pretty convincing records of what were likely influenza pandemics starting from at least 1510. So humanity has been dealing with this virus in various forms for a very, very long time.
Even the name influenza has a fascinating history, right?
It does. It comes from medieval Latin, influentia. It originally meant a visitation or an influence, often implying something flowing down from the stars or heavens.
Influence of the stars.
Exactly. In the 14th and 15th centuries, outbreaks were sometimes attributed to unfavorable astrological alignments, the influence of the stars causing widespread illness. It's amazing to think about how explanations have evolved.
From stars to viruses, and we've certainly seen the devastating impact of pandemic influenza more recently.
We have. Since 1900, we've experienced 5 major flu pandemics. The most catastrophic by far was the 1918-1920 Spanish flu. It was caused by an H1N1 virus, likely of avian origin. It killed an estimated 50 million people worldwide, possibly more. And unusually, it hit healthy young adults particularly hard.
Just devastating.
Then we had the Asian flu in 1957, H2N2, the Hong Kong flu in 1968, H3N2, and more recently, the 2009 swine flu pandemic, a novel H1N1 that emerged from pigs. Each of these events was caused by antigenic shift, introducing a new virus subtype that spread globally.
And each pandemic changes the landscape of circulating flu viruses afterwards.
It does. The pandemic strain often replaces the previously dominant strain of that subtype and continues circulating as seasonal flu for years or decades afterwards, undergoing its own antigenic drift.
And we keep mentioning animals, birds, pigs. They're clearly central to this whole story.
Absolutely crucial. Avian influenza, or bird flu, is particularly important. We distinguish between low pathogenicity, avian influenza, LPAI, which usually causes mild illness in birds, and highly pathogenic avian influenza, HPAI, like certain H5 and H7 strains, which can cause severe disease and high death rates in poultry flocks.
And HPAI is the one we worry more about jumping to humans.
Yes, although direct bird-to-human transmission is still relatively rare. Some HPAI strains, like H5N1, have caused severe infections and deaths in people who had close contact with infected birds. The concern is always that such a virus could adapt to spread easily between humans, potentially triggering a pandemic.
And swine flu in pigs.
Pigs are important because, as we discussed, they're susceptible to infection with both avian and human flu viruses, making them potential mixing vessels for reassortment. The 2009 H1N1 pandemic virus was a complex reassortment with genes from human, avian, and swine influenza viruses.
It's a complex web. Horses, dogs, even seals get their own flu strains too.
They do. The interconnectedness of influenza viruses across different species highlights why a One Health approach, recognizing the link between human, animal, and environmental health, is so important for flu surveillance and control.
So looking ahead, with all this constant change, globalization, what's the outlook? Are more pandemics inevitable?
Many experts believe that future influenza pandemics are, unfortunately, almost inevitable. The question isn't really if another one will happen, but when and how severe it will be.
That's a sobering thought.
It is, but it's also why global preparedness is so critical. The World Health Organization coordinates the Global Influenza Surveillance and Response System, or GISRS. It's a network of labs around the world that constantly monitors circulating flu viruses in humans and animals. They analyze millions of samples each year, tracking antigenic drift, watching for novel viruses emerging from animals, and detecting antigenic shift events early. The surveillance informs the annual vaccine composition and helps trigger pandemic alerts and responses.
So it's an ongoing global effort to stay one step ahead, or at least keep pace.
Exactly. It's a continuous challenge, this intricate dance between us and these incredibly adaptable viruses.
Well, we've covered a lot of ground today. We've gone from defining influenza, really pinning down what it is and isn't, through the fascinating, almost sneaky ways it spreads and constantly changes its disguise through drift and shift,
Right.
to understanding who is most vulnerable to severe illness, and most importantly, what we can actually do. Vaccination, hand washing, antivirals to protect ourselves and manage it.
And I think ultimately what this deep dive shows is that while influenza is undeniably a complex and, yes, a formidable opponent, understanding it really does empower us. Knowing the science behind it helps us appreciate why things like the annual flu shot are so important, why staying home when sick matters, and how to make smarter health choices for ourselves, our families, and the wider community. Knowledge is power here.
It absolutely is. So as you go about your day, maybe take a moment to think about this invisible world of viruses, this constant evolutionary dance that has shaped human history for centuries and continues to challenge us. It really makes you wonder, what will the next influence, the next major shift look like, and how ready will we collectively be to face it? Something to ponder.